so long, I'm sorry.
Rolling.
Ready? Alright, so physical signs of death, these are kinda obvious. Unresponsive to painful stimuli, lack of a carotid pulse or heartbeat, absence of breath sounds, no deep tendon or corneal reflexes. Absence of eye movement, no systolic blood pressure, profound cyanosis, that means they're blue, or lower or decreased blood pressure. Definitive signs of death, a body part, or a body is in part, it's decapitated, can't be attached to head. Dependent lividity, so this is blood pooling, and you can tell someone put their hand there to check it. Rigor mortis, this usually occurs between 2 to 12 hours after death. Algor mortis is cooling of the body until it matches the ambient temperature. So your normal body temperature is 98.6. If we go in and they feel just like the room, they're typically putrefaction or decomp usually occurs between 40 to 96 hours after death. Summertime in Alabama might speed that up. I have seen us have to put on full SCBA to go get patients out of houses because they are so decomp. Medical examiner cases, so we have a coroner that comes in and he will send it, he makes the decision on whether it's gonna go to a medical examiner or not. But all calls outside of a hospital are considered, criminal until proven otherwise. With the exception of hospice. So, death without previous medical care, suicides, violent death, poisoning, overdoses following or poisoning. Death from accidents, suspicion of a criminal act, infant and child deaths. Any death outside of a hospital, with the exception of hospice, the coroner gets called, at least in Morgan County. Pretty sure Marshall's the same, as Lawrence the same.
Yeah.
I think that's a state thing, but I haven't worked enough in other counties to know. But any death outside of the hospital that is not hospice, the coroner is called, and then he makes the determination on whether it goes to an Indian or not.
Marshall is the same.
Marshall is the same. I figured it was.
Now, I think if it's whether or not he shows up 100% of the time, I don't know about that. But like, I know the past 2 deaths, three deaths, he's been there. And he does the toxology
Yeah.
with the heart and everything, but like, I don't know if he shows up. But I know they may call, like if there's somebody that was DOA,
Yeah.
like
Our coroner comes, either the coroner or the deputy coroner has to come and we'll
Okay,
examine.
I don't know.
Because it's a
100%.
criminal investigation.
Right.
So you have to,
And Marshall County, they have to come to the hospital too for the.
do, I think they might come to the hospital too, but they're not considered criminal
Mhm.
if it occurs in the hospital. Unless it was a shooting that we took in or something like that. So organ donors or special situations. Y'all, I don't typically look to see if someone's an organ donor. Maybe I should, but I don't. That's typically a hospital issue. Now, this may be an exception to that DNR rule as well. They may come up and be like, hey, you're an organ donor, can you see what you can do? And we'll put the Lucas on, we'll give them some oxygen and try to get them because they're an organ donor, because you're just trying to keep the organs alive. That's a weird situation. I've never been in that situation, so I don't know what I would do. I'd probably call my doctor and be like, what do you want me to do? I haven't been in this situation before, and go from there. They may have an organ donor card or a driver's license. Our job is to save a life. This may be a card that they have, or like we said, it may be marked on their driver's license. Medical insignia, bracelet, or something like that. So the DNR, it might say DNR on the bracelet, it should tell you where the paper form is. Like it might say DNR on the top, and you flip it, and it says it's stored here, or something like that. I've even seen on the ones that you can open, and they have a really small one. I think that's crazy, but hey, you know, like they'll be able to get it printed on a card and fold the card or something up in there. It can say allergies, special medical information that you may need to know. This is diabetic. They're mute. They're deaf, something like that. Some people will have a flash drive in their USB or USB in their bracelets now that you can take out, pop in your computer and get their medical history. Some of them now, have QR codes. You flip them over, scan the QR code and use your medical information. I like the QR code over the flash drive, but.
In, California, they're trying to take QR codes.
You know what?
California, they're trying to take QR codes themselves.
I'll leave that one alone. So that's a type of medical bracelet. There's a couple different other types. So your scope of practice tells you what you can do. It's usually defined by state law. We will go over this in detail more when we do protocol updates. I'm waiting for the protocol updates because some things are changing. We will do a brief overlay of what you can do on your clinicals and your scope of practice though. We have protocols, we have standing orders. They're kind of the same thing here. You can, if you carrying out procedures outside your scope of practice may be considered negligence or a criminal offense. That's why we were saying, say you're on your clinicals and they're like, hey, go start this IV for me. Hey, I'm so sorry, that's not my scope of practice, I can't do that. I'll be glad to come watch you, I'll be glad to hand you anything you need, but I can't do that. Hey, go give this medication, I'm sorry, that's not my scope of practice, I'll be glad to come assist you with it. A difference would be the nurse is standing next to you, hey, go ahead and just have her chew this up. It may not be something you can normally give, but she's just handing it to you to give to the patient because you're closer. Gray, I guess it's considered a gray area again, but that's kind of a direct order, and it's not you doing it on your own.
Taking medicine from somebody with higher power?
Yeah.
Is that what, like a nurse?
Yeah, like you're on a clinical and the nurse hands it to you and says, hey, give that to the patient while she's standing right there in the room.
You're
with
working
you.
under her license,
Yes.
technically.
Technically.
Yeah.
Standards of care are a manner in which you must behave. You must be concerned about the safety and welfare of others. Standards are established by local custom and law, statutes, ordinances, administrative regulations, case law, professional institutional standards, so AHA guidelines, your hospital guidelines, your work guidelines, state protocols, textbooks. The textbooks lay out a lot of the guidelines, and a lot of the protocols are based on what comes out of the textbooks. We have the National Scope of Practice EMS standards for education. So anything that I teach y'all that's not in the book, I pulled directly from that EMS standards, education standards, to follow through. Now, does that mean that I'm not gonna say, hey, this is how I do this? No. And you know, Mike may do it different, Izzy's teaching tomorrow, she may do some things different, Mason may do some things different, but the point is, we're all following a certain scope of standards. Standards are imposed by states, Medical Practices Act, certification, licensure, credentialing. In Alabama, we do not do credentialing anymore, but we used to. I'm trying to work on getting some, credentialing type stuff put back into us at the ambulance service, where we have to do skills in front of a doctor at least once a year. Licensure, some states require you, different things to get their license. In Alabama, you need a national registry card or certificate, a current, and it's gotta be current, current AHA CPR, and current EMS protocols. You also have to do a background check. They used to do a drug screening, but they assumed that the schools and stuff in New York do the drug screening now. But in Florida, you have to take a state test as well as have a national registry card. And then where, like, Texas, where the different medical directors teach you different things, they may require different things per service, just because of how they're set up. Alright, this is negligence. These are important. You have a duty to act. Individual responsibility to provide patient care. Here's where some of the issues are gonna come in. We're gonna talk about it from the ambulance side, then we'll talk about it from the volunteer side, okay? So once your ambulance responds to a call and once treatment is begun, your duty to act applies. That means if you're with the volunteer department and you do not respond, you do not have a duty to act. However, if you respond to that call, you have a duty to act. If you are driving down the road technically do not have a duty to act. However, if you have a firefighter or EMS tag, it would be in your best interest to do so. Because otherwise you have driven past an incident and they see that this was a firefighter or EMT that drove by. They may not be able to say it's exactly you, but the point is still there. But once you respond, so once the ambulance responds, or once you as a volunteer respond, you have a duty to act. Negligence is the failure to provide the same care that a person with similar training would provide in the same or similar situation. So, what all of you would provide would be different than what I would provide, correct? In some instances, right? Now, if I run someone with a cough, I may not do anything different treatment-wise than you would as a basic, because there may not be anything more for me to do. But if we run someone with an open fracture, you may put a traction splint on them and I may give them pain meds. I wouldn't expect you to give pain meds. But would I expect you and you to make the same treatment decisions? For the most part, yes. Make sense? So, you have, these are the 4 elements of negligence. Like I said, this is the big thing. Duty, breach of duty, damages, and causation. So, when did your duty start? Once you responded, you got the duty part, right? So, breach of duty. You've responded to the call, but you provide no treatment whatsoever. Have you breached your duty?
Yeah.
So, res ipsa loquitur. The cause of the injury was in the control of the EMT. Generally does not occur unless there is negligence. So, you responded to the call and you saw they were bleeding out, but you didn't do anything to stop it. That's negligence, right? That was pretty clear cut. But negligence per se, the conduct of the person being sued is alleged to that occurred in clear violation of a statute. So you acted outside your scope. That would be negligence per se. You can put a tourniquet on a bleed, but then you, I don't even know how, you just worked outside your scope of practice. So, okay, we had an instance of an EMT that started an IV in the back of the truck. You know how they made it even worse? They documented their medic partner did it. That could have been negligence if someone had wanted to. That would be, and then torts are civil wrongs, and torts are, those are the ones that are fun. So, what you did or didn't do caused the patient injury. And as a result, they sued you for it, is what it boils down to. You had a duty, you didn't do it, somebody was hurt because you didn't do what you were supposed to do. Negligence. That was pretty straightforward. You would be surprised how many people miss those questions and miss the understanding of that. Abandonment. Unilateral termination of care by an EMT without patient's consent or making provisions for continuing care. Just because the ambulance arrives on scene, does that mean that your care stops?
No, not until somebody, firefighter comes and relieves you, I would think.
Yeah. Just because I pull up on scene doesn't mean you can stop and walk out, right?
Right.
And would it probably be a good idea to tell me what you've done and what's going on before you just walk out? Yes. So if you walk out without someone taking over the care, you've abandoned the patient.
Something that's affecting us right now is getting to the hospital and not being able to turn over care because there's nobody to take over care. Sometimes we have to sit there and manage the patient.
Yeah, like on the ambulance, we get to the hospital and there's not a nurse to sign for our patient. So we stay with the patient until someone can take care of the patient or take responsibility of the patient. however you wanna look at that. Abandonment may take place at the scene or in the emergency department. Now, you're providing care and the patient pulls a gun on you and you leave, have you abandoned the care?
No.
No, you protected yourself. That gray areas. Don't you love medical, like all the gray
All
areas?
great.
Always obtain a signature on your patient care record. Now, a lot of volunteer fire departments do not do this to the ambulance, and that's okay. If, I know y'all are thinking about getting an ALS and y'all have talked about it, if you provide an ALS type, if you start an IV, you probably want me to sign that I took over for that patient, because that's the care you provided. You don't have to, but good practice. If you gave a medication, yeah, I would definitely get someone to sign that. Now, I'm not talking aspirin, nitro, I'm saying if y'all go the ALS2 and you give Toradol, which is really strong ibuprofen, you would still probably want someone to sign, just to practice, good practice. Assault, battery, and kidnapping. Assault is unlawfully placing person in fear of immediate bodily death, harm, and battery is unlawfully touching a person. Okay, think of it like this. Assault is the threat, battery is the action. They are two separate things. You have done something that makes me fear for my life, you have assaulted me. You have beat me with a baseball bat, you have battered me. They're both unlawful. They use the example of restraint and providing care without consent. I'm gonna go so far as to say physical restraints are battery. They could argue that in court. Kidnapping. I explain this one to patients and family members all the time. Let's go back to what we know about alertness. If someone is ANO times 4, says, I don't wanna go to the hospital, and I say, you have to go, I picked them up, I put them in the ambulance, and I drive to the hospital, guess what I've done? I kidnapped them. With that, I can be sued and I can lose my license. Do you know how often I have to explain to family members, I'm sorry, I cannot, this is kidnapping, they can charge me. We're not gonna do that, I understand you think that, but I could still be charged. The hospital could charge me on the patient's behalf if they really wanted to. So, seizing, confining, abducting, or carrying away by force. False imprisonment is unauthorized confinement of a person. So, we don't do a lot of false imprisonment, but what if we kidnapped them and then put them in restraints? They're alert and oriented times 4, we say they have to go to the hospital and put them in restraints to get there. We falsely imprisoned them as well. That's not something we're gonna do, but it is something that obviously has happened at some point for us to have to be taught about it, right? Defamation, libel is written, slander is spoken. Think about social media with this. Good Samaritan laws. If you reasonably help another person, you will not be held liable for errors or omissions. So, you have to do it in good faith, without expectation of compensation, within your scope of training, and did not act in a grossly negligent manner. You're driving down the road, you're not in your coverage area, we're gonna take you out of your coverage, because in your coverage area, you've got the duty to act in the coverage. You're on your way here, you stopped at that record there. You provided care. You would fall under Good Samaritan law if someone wanted to sue. Because you stopped, provided the care that you, even if all you're doing is, hey, is everybody okay? And, oh, you're bleeding, let me put my hand on there and stop it from bleeding. Because that's, you may not have much training, but how do you stop bleeding? You put pressure on it, right? If someone wanted to sue, you could fall under the Good Samaritan law. If you're in your coverage area or you have been dispatched, that falls under the negligence and duty and everything.
This is the, same thing for CPR or bystander
Yes.
CPR.
Bystander CPR.
It's in the same category.
Immunity statutes apply to EMS systems that are considered governmental agencies. Sovereign immunity provides limitations on liability and immunity is not complete. So records and reports, compile a record of all incidents involving sick or injured patients. Fun fact, Alabama says if you're dispatched or you are issued a dispatch number, you should do a record on it. It's a safeguard against legal complications. The courts will look at action not reported, was not performed. If you don't write it down, you didn't do it. Incomplete or untidy reports is evidence of poor emergency medical care. Now, this is not saying that you put everything in there and forgot to put one thing. That's different. This is distracted, not complete paperwork. National EMS Systems provides the ability to collect, store, and share standard EMS data. It's used to improve the speed and accuracy of data collection. We report to the state reports to NEMSIS. But that's why we get NEMSIS errors, because the state's tied to NEMSIS. Because if we turn in paperwork wrong, sometimes it will send it back to us, hey, there was a NEMSIS error. And a lot of times it's that we put something wrong or forgot to put something. It's usually a simple fix, but it will tell you and it will tell you where it's at. Most states have a reporting obligation. We are mandatory reporters. If we see abuse, child abuse, spousal abuse, elder abuse, dog abuse, y'all, I mean, because if someone's going to abuse their dog, they're going to abuse their people. Injury during commission of a felony. So, you ran the wreck call and he told you that he wrecked because he was running from the police from where he robbed a bank. You have to report that. Yes, that is a very, we're liable to get more, hey, I wrecked because I was running from the cartel because I stole their drugs. But you have to report that. Drug-related injuries and childbirth. If you do a home delivery, you have to report it.
To the NEMSIS, or,
So, no.
no,
You have to report these to law enforcement. Abuse will be reported to law enforcement.
Right.
Yeah. So, how we typically do this is, if you're volunteers, you're gonna tell me, hey, I suspect this is why I'm gonna ask you to document it, and then I may need to get a copy of your document report. Then when I get to the hospital, I'm gonna tell the nurse, and I'm gonna document it, and it's the nurse, the hospital typically reports it to DHR or wherever it needs to go from there. Dog bites have to be reported in Alabama. Childbirth, I think I called the doctor on this one. I've never done a home birth that hasn't been transported. Mike, have you?
Yep.
You just call the doctor and report it?
Yeah, they Alabama has started using midwives now, and I ran a call where baby came out breech. The midwife got a little excited and called 911. We got on scene and the baby had already delivered. Baby was fine, everything was good, and called the doc and he was like, "Yeah, let him stay. That's fine."
But in that instance, the midwife may be the one that's reporting it to DHR or whoever to record the actual birth.
mm-hmm.
So I would just call my doctor and let my doctor tell me what I'm supposed to do from there. Yes.
So if it's drug-related injury, we have to report it. So if he ODs, whenever he dies, he falls and his head on the bed, now he's bleeding from his head because he OD'd.
He should be notified. Yeah, I know.
If you show up for a chest pain and they're having chest pain because they have a knife in their chest, that needs to be reported
Because that's criminal.
that's a criminal act. Yeah.
Attempted suicide, dog bites, communicable diseases. Now, I'm not talking about the flu. Yes, we should tell someone to have the flu. But what if you come to a house that has tuberculosis? Or measles, mumps? The stuff we don't see a lot. That definitely needs to be reported. Because those are very, people are dying from the measles and chicken pox now because we don't get them anymore. You know? TB is making an impact. We got a bunch of immigrants hit recently, and they're bringing, other countries don't have the immunization standards that we do. So they're bringing in tuberculosis, measles, mumps, scarlet fever, chicken pox.
Nukes.
What?
Nukes.
What's that?
Nuclear weapons.
Oh. I'm talking about communicable diseases over here. Assaults, domestic violence, PD can now file charges on behalf of someone without them having to file. Sexual assault or rape. exposures to infectious diseases, transports of patients in restraints, scene of a crime, the deceased. This goes back to, we call the coroner on all deceased patients. If they're under hospice reports. Scene of a crime, if you roll up and you're like, hey, this person fell because they got shot. That's a crime, and that has happened before, Ethical responsibilities. So ethics is the philosophy of right and wrong, moral duties, and ideal professional behavior. Ethics is where the gray is. Morality, code of conduct affecting character, conduct, and conscience. Bioethics specifically addresses issues that arise in the practice of healthcare.
Something you guys will see on your clinicals is if a violent crime comes in that's unreported, the hospital is going to go on lockdown, and so the ED will be on lockdown. That just means that general public can't come and go. You'll have a badge, so you'll have badge access to get in and out as you need to. But say somebody rolls in POV with a shooting, or a stabbing or something of that nature, they don't know who the shooter is or where the shooter's at, so they automatically put the ER on lockdown. You'll see that.
Or a domestic situation, so a male or female that's been assaulted and they don't know where the assailant is, they'll lock the ER down. Yes, sir.
Y'all just had a lockdown.
Oh, we got lockdowns daily.
Like,
Daily. I mean, we get the text messages. We're getting lockdowns all the time. So ethical responsibilities require you to evaluate and apply ethical standards of your own and those of the profession. So this is how I look at it.
She's like, what?
We all tend to kind of have our own ethical codes, and we surround ourselves with people who tend to think like we do. But then we have standards of healthcare. Is it ethical or unethical to say you overdosed, so I'm not going to treat you? Is it ethical or unethical to say you're an alcoholic and you caused the death? I don't care what happens to you. Is it ethical to say you're drunk, so I'm going to start a 14-gauge needle in your pencil? Those are stuff that people look at. That's where ethics comes in. We have a duty to provide care. This comes back to that compartmentalization. You can't let your personal opinion affect your care of the patient. I can think that someone is absolute worst person on earth and I don't want to have anything to do with them. I still have to take care of them. I take care of a death row inmate the same way I do a newborn baby. I might have opinions that I voice later to my partner, but the treatment we provide is the same level. I don't treat you any differently because of how I feel about you personally.
You don't try to inflict pain on them because of something they did.
Right.
Yeah.
But it also goes back to male, female, black, white, red, green, poor, rich, same.
You'll see like memes on Facebook and stuff like that where like, the drug overdoses get to pick their own IV size by what's your favorite color kind of thing. Those are the kinds of memes that you probably need to stay away from if you're professionally doing this or doing this in a professional capacity. Because if something does happen and you wind up going to court, they're going to pull those records from Facebook and all these other social media sites. And if they see a pattern of you posting or liking or being involved in those kinds of memes, that will come back to bite you in the rear end.
Your best rule of thumb whenever you're treating these patients is find the person that you love the most and treat your patients the same like that. You don't have to look at them the same, just treat them like that. Treat them like the person you love the most. I call every single one of my patients good nickname. I call them sweetheart, buddy.
We're not supposed to do that, but we all do it.
Yeah, that's how I do it.
And there's nothing to say that you didn't make a difference by treating them this way. I can't tell you how many times I've had a patient say, why are you doing this? And I say, what? Well, why are you being respectful to me? And it actually make a change. I've actually had people agree to go to rehab and come out of it successfully just because I didn't treat them like everybody else was. So, does it happen all the time? No, but it can. You never know when you're gonna make a difference just by being a good person. Or at least pretending to be a good person. Cause like I said, you can think someone's a piece of trash and still treat them the way you would someone you care about. EMTs can end up in court. You can be a witness, you can be a defendant. Case can be civil or criminal. Whenever you're called to testify, notify your service director and legal counsel. Your service should provide legal counsel for you, but it is not saying that you can't provide your own. As a witness, remain neutral, review the run report before court. As a defendant, an attorney is required. Defenses may include statute of limitations, governmental immunity, contributory negligence. Discovery allows both sides to obtain more information through interrogatories, which is written requests or questions, or depositions, oral requests or questions. They're going to request your patient care report. You can guarantee that if they don't do anything else, they're going to request your patient care report. Most cases are settled following the discovery phase. During the settlement phase, if not settled, the case goes to trial. You may have to pay money or be put in jail.
How much is it for like,
Depends.
bail?
Depends on what the case is. I mean, if you're convicted of murder, it could be life. If you're convicted of negligence, it could be 2 or 3 years. It all depends. An EMT charged with a criminal offense should secure the services of a highly experienced criminal attorney immediately. And I will tell you this. Every question, referring to my PCR. Referring to my PCR, you do not put your opinion. You do not say, I remember this. According to my PCR, if you didn't write it, it didn't happen. That means you can't remember it. That is the best course of action. That's why you should write that PCR like it's going to court. Alright. You arrive at the scene of an older woman complaining of chest pain. In assessing her, she holds her arm out for you to take her blood pressure. This is an example of what type of consent.
He's fast.
Yep, because she said here, go for it. Which of the following is an example of abandonment?
I would say A.
It's gonna be D because you
D.
transferred to a low, it has to be the
Okay,
same or higher.
okay, I see, because you went lower.
Yeah.
Can it be equal or higher?
Equal or higher,
Okay.
equal or higher.
Technically, if you're a paramedic, you can't release care to an LPN. Technically.
Technically, we do it. Now, and here comes the thing too, if you're a medic with the fire department and you get a BLS ambulance to respond, do you not release care? So, I mean,
We can downgrade now.
you can call it a downgrade at that point, but, you wouldn't, you know, just release it to whoever. The unauthorized confinement of a person is false imprisonment.
The other thing too is like your level of licensure is attached to the level of licensure of the agency you're working for currently. So, like with you guys at Speak, when you
Even if Gunner's on scene, you're still a basic.
yeah, he's still a basic, unless you guys are ALS that I don't know about.
So failure of the EMT to provide the same care as another EMT with the same training is negligence. An 8-year-old boy was struck by a car. He's unconscious and is bleeding from the mouth. A police officer tells you that he's unable to contact the child's parents. You should. is critically injured, you would provide care. An advanced directive is,
A.
let's see. Which of the following patients is competent and can legally refuse care?
See,
See. We're not gonna go through all of those, y'all seem to have a grasp of it. That ends medical, legal, and ethical. Any questions beyond how much of gray areas there are in here?